So first, I would like to ask for your permission to use this video for educational purpose on internet.
Yes.
So I have your permission to do
Yes.
that? Excellent. Now tell me, how long have you had pain before we met?
About 5 years.
How bad was the pain?
It was up to a 10.
And you went through many processes and practically nothing really helped you.
No, nothing.
Can you explain a little about what you went all through? And
I did a lot of MRIs, I did CAT scans, I did all kinds of stuff. I went to physical therapy, and I was on narcotics for,
for 5 years. And I bet you went through lots of pain and suffering to just get your pain medication, and
Yeah.
all of that came that you and I then we met about closer to a year ago.
Yep.
But we looked at your MRI, and I can understand why lots of doctors said that there's nothing wrong with your back, but your symptoms were very specifically corresponding to this level, to this level and this level. You have what we call a transitional S1. You have a extra vertebra, but this level and this level is where we paid attention to. And there is some disc bulging, and your symptom very clearly corresponded to that. So it was no doubt in my mind that this is a real thing.
Yeah, it was real.
And so we did a discogram, and here is the result of the discogram that shows literally these two discs are falling apart. This one wasn't great, but the result of the discogram showed that this level and this level is what's causing your pain.
Yeah.
Based on this information, we went and did the surgery. We did that minimal invasive OLLIF procedure. Can you tell me about that, when the surgery was and how did it go and how you were doing afterward?
Well, I wasn't too sure about the surgery, but I did it, and my kids wanted me to do it, so I went through it. And the day I had surgery on a Wednesday and Thursday, I went home, and
So one day after the surgery?
one day after surgery, I went home. My kids were there, and I took narcotics for maybe 5 days. I'm
So-
off them, all of
okay.
them.
So you were 5 years on narcotic, but 5 days after the surgery, you came off the narcotic.
Yes, I did.
Excellent. Well, that must have been a little hard transition. Was it hard?
Well, I got the shivers,
Okay.
but I made it.
Okay. Now, how are your symptoms now?
I have no pain.
Okay.
No pain. I work as a daycare provider. I can bend. I can go on the floor and get back up off the floor.
Okay.
So I'm back to
And,
where I need to be.
And I think that is the power of the discogram that could show us the pathology, what's wrong with your back. And and I'm happy that the procedure, the OLLIF, worked for you. And this is to just show that why we do the discogram, because as you see here, and I agree with many of my colleagues that if they say that there's not much pathology here, indicating that you need a fusion, but once we did the discogram, we could prove that. And your result of that we have to take patients and their symptoms more seriously and really investigate it. Are you happy so far with
Oh,
the surgery?
I'm very happy.
Excellent. I appreciate and thank you for your interview.
Yeah.